problem with public health messages is that there's a lot of nuance, right? And it's really hard to get it right because some people often don't listen till the end. They just hear what they want to hear and they're done. The important message from the CDC recommendations was, number one, recommendation for persons who are getting vaccinated. It's just that, if you're vaccinated and you've had the 2 weeks after being vaccinated and you're within the 3 months, there are little details that you have to think about, but you don't have to quarantine if you're exposed and you're asymptomatic and you don't have any symptoms. So that's actually important because before that, if you're exposed, you have to still go through like the whole testing and quarantine. So for me as a healthcare worker who's more likely to get exposed, that actually is good news. Then the second message is in terms of what does that mean for people who are vaccinated, and what is it that you can or can't do? I think that it was a very powerful message for grandparents who are local to say, you're vaccinated and you can visit your grandchildren, and even though they have not been vaccinated yet because we don't have a vaccine, but if they're low risk and they're healthy, you can, in your house, get together with them, take off that mask and hug them. I think that was a very important message that we needed to hear. And I think when I was listening to Dr. Walensky yesterday too, she tried to do the nuance thing, which is, but if you're around people who have not been vaccinated, it's important to know that we're still going to have to follow those public health measures. And I like that there was actually an alternative, which said, go outside. Outside is better than inside. Wear a mask. Still be safe, but you can still do things safely.